Thank you very much today for the invitation to speak at this international gathering to discuss what I think is one of the most fundamentally important issues confronting our times. Can I also begin by acknowledging that we stand on the land of the Guerra people and pay my respects to elders past and present, any in the room, and to any other Indigenous leaders from the world here. I need to start by saying that the organisation I work for, the Centre for Multicultural Youth, is unique internationally. Many of you who are not from an Australian context, it is an organisation that is a bridge between young people who are from refugee migrant backgrounds, the mainstream youth sector and the many government departments that work with them. We really try and be a vehicle and a voice for them in bringing them together. Today, Swathi and I are going to talk about what mental health looks like for young people who are refugee migrant, and I'll talk about that in a minute, and why there is such a low take-up rate of mainstream mental health services, and then pose some questions that I would love the audience to discuss with us. And I'm drawing on my own experience as a non-mental health practitioner, but someone who's interfaced with young people for over 30 years on mental health issues, and for work that our organisation has done over the last 18 months with Origin Health. So let's start with the global context. We all know that the 21st century has seen the greatest movement of people unequal to the Second World War. There are close to 71 million displaced people, of which close to 50% of those are children. And most of the refugees of the world are being looked after by countries that are either poor, underdeveloped, or do not have the capacity to look after them. Countries like Australia and Canada, the US, and an increasing number of European countries are now taking in refugee communities, but we take a very small slice. So out of that 70 million that are displaced, Australia takes in 18,000 refugees through what we call the humanitarian program, of which 50% are young people under 25. But what else has also been created is that the world is much more complex than it ever has been. Many countries, my own heritage country of Italy, and I've spent a lot of time there in the last 5 years, that was once considered itself to be homogeneous, is no longer. My family's village, 1 hour from Naples, has African communities living there, and they're not living there with much love from the locals, I can tell you. But yet that country is fundamentally different to what it was 5 years ago. It is much more increasingly ethnically, religiously and culturally diverse. But today I'm going to talk a little bit about what Australia, who, like our cousins from Canada, and there are many of you here today that I've met, consider ourselves a very successful multicultural nation, but yet I think we have failed many of the young people from refugee and migrant backgrounds in the mental health system. So if I start with some data, just some high-level data. Australia's youth population is increasingly diverse. From when I was a young person and I trained as a youth worker, and there was only 2 of us out of 150 students who were refugee and migrant background, to now every second young person in Australia is either born overseas or their parents are born overseas. So when I, in the Australian context, use the term refugee and migrant, I am referring to either a family, young person who's either born overseas or one of their parents has born, so it encaptures the ancestry numbers. In our humanitarian program that we have, whether it's sponsored refugees or migrant, 1 in 4 of any arrival that comes into Australia is under 30, and Australia takes close to 200,000 people in through our migration program. The other data I want to reference is that people who come from humanitarian backgrounds have much higher levels of psychological stress. That would not be unfamiliar to many of you in this room. And that there are strong links between mental ill health and the experiences of racism and discrimination, with a number of research studies highlighting that young people, particularly in Australia and around the world, are reporting much higher levels of racism and discrimination than ever seen before. And this is for a combination of what many of you would know, social, cultural, psychological factors that negatively impact on the mental health and well-being of young people. These include things such as the whole migration process, separation from family, local economic status, insecure housing, and then you add trauma of the migration and refugee experience, intergenerational conflict, language, cultural issues, and the whole issue of finding yourself and finding an identity in a new country where you are generally welcome but at times not welcomed. Some recent work that we've done in Melbourne, for those of you who aren't from Australia, there have been a number of issues in my home state around the issue that has been labelled African youth gangs, increasing numbers of young people from African backgrounds who have seen themselves in trouble with the law and police. Well, from that work, we have seen in the last 6